Welcome to presentation number 2. As we discussed in the first presentation, we talked about injuries and how you develop pain, and eventually over time, years and decades later, you develop a lot of degeneration and arthritis. So now we're going to go through what's causing your problem, and again, why isn't it going away? And it doesn't matter if it's your hip, it's your spine, it's your knee, it's your foot, it's your ankle, your hand, your elbow, your cervical spine. It doesn't matter. What matters is that these injuries are basically all the same, except they just affect different muscles, different bones, different ligaments, and different tendons. So this is how these injuries start. So connective tissue damage is what we're going to discuss now, and this is the beginnings of arthritis. So if you look at figure 1, you're going to see a joint is always composed of two bones. And the joint is held together, the bones are joined together by ligaments. And between the bones is either cartilage, or in the spine is a disc that acts as a shock absorber to protect the ends of the bones. Muscles attach, by tendons. So muscles attach to bones by tendons, and ligaments attach bone to bone. Now these little squiggly yellow things are nerves that cause your muscle to contract, pulls on the tendon, moves the bone, and the ligaments and the shape of the joint dictate the motion of the joint. From stresses and strains and accidents in life, you develop situations as in figure 2. Now don't forget, we have roughly around 640 muscles in the body, 206 bones, and I think about 350 joints. And any one of those or combination of those joints could be damaged based on your lifestyle and based on all the previous injuries that you have. So this could be systemic. This is throughout the whole entire body. So when you develop situations like this, you damage the ligaments, the vertebra or bones now move out of alignment, and now the muscles themselves start to tear. There's a skin around the muscle, and that starts to tear, and as that starts to tear, it develops lumps, and it becomes very fibrotic, which means that the muscle itself is very, very tight, it loses flexibility, it loses its strength, and it becomes painful and aches a lot. So eventually what happens is when you develop damage within the ligaments, the reason why it usually doesn't go away on its own is, number one, ligaments do not get good circulation. Cartilage does not get good circulation. In fact, they almost say it's avascular, so circulation is very nominal, so healing occurs really, really slow. Not to mention if we're talking about a weight-bearing joint that you keep on re-injuring due to repetitive motions, for example, your occupation, then it's not going to ever heal. Now, once you develop this connective tissue damage, it goes to the next phase. So we're going to look at pictures of the spine which show that this is the cervical curve of the spine. You can see it's forward. That would be the back of your head, and this in the front would be your jaw area. So you can see that curve goes forward. Now I want you to understand that if you look at this picture, the spine is going in reverse. There's the back of your head, there's the jaw. So instead of the curve going forward like this, it's going in reverse. The only way it can go from forward to reverse like that is if you had this to figure 2 with the damage. Once you can do that, what will happen is that you'll go from 1 to 2. Once the spine is out of alignment, now it's very weak, and now the disc areas in the spine start to degenerate. And eventually the vertebrae start to fuse together, and eventually you have total fusion back in this area. So that's how arthritis begins. It starts as a simple soft tissue injury, and eventually grows into severe degeneration and arthritis, to the point where you would require surgery on your spine, surgery on your hip, surgery on your knee, surgery on your shoulder. So as you go through these phases, you can see phase near normal to phase 1. And the only way that can occur is like we talked about with the soft tissue damage. The next thing is that once you start to develop that damage, then you start to develop degeneration between the vertebrae themselves and the disc areas. And that may take decades. Eventually that does lead to fusion. So this is how arthritis begins, and arthritis is not what's causing your pain, it's the injuries that we discussed before. This is how it looks on MRI. You can see how the spinal canal is pinched off because the disc is bulging out in there, and this is the way it looks on X-ray. And this is not only for adults, children can also have scoliosis or bad curvatures in the spine that are causing all kinds of other problems, not to mention just spinal or painful problems, but affecting all their organs, such as their lungs and their heart, because the way the spine moved. So this is exactly how arthritis develops. It develops from the soft tissue or connective tissue damage, and through many, many years and repetitive traumas, it develops to a point where it just becomes debilitating. And it just progressively gets worse as time goes on. It does not get better. So, how do we treat these conditions? Because, by the way, what I want you to understand is that I had severe back pain. That's how I got into this profession. And I knew it was getting worse. And in my early 20s, I didn't know what I was going to do, but I knew I had to do something. Fortunately, I learned about chiropractic, and fortunately that helped bridge the gap and taught me a lot of things that I would have to do to help improve myself. So in the next presentation, we're going to talk about all the different things that we're going to do and we're going to help you do to get you better. Until then, have fun.